Okay, we're going.
Are we going?
We're going.
Are we recording? Yay!
All right, so I need to get by you.
Okay, can you get by me?
Hold on.
Hot dog.
We are trying something brand spanking new.
We are.
Alexa, mute. Okay.
So here we are. Hi, Susie here.
Matt here.
We're Susie Health Solutions.
Just patience here.
And I'm going to be patient.
All right, start now.
Are we live on Facebook?
Allow microphone. We are not live on microphone.
Okay, we're just recording.
We're recording. We'll put it on YouTube and then we'll carry it over.
Gotcha.
Start. All right, here. Cool. It's looking so hard because I'm literally kicking the start button. It's not starting. Microphone's up. Hand goes over. Please use mic or headset to call in. Okay. This is off air. Start. There we are. We're live.
Hey, we're live.
Okay.
So the microphone's working.
And microphone's working, I think.
We think.
We'll
know more later.
know later. We are live on the air on Podbean.
Hi.
We will be broadcasting this later on YouTube and our Facebook channel.
Right, this is a beta test, to be honest.
This is a beta test. This is the first time.
Yep.
I kind of put this thing together on the fly today. This is, I nicknamed it Suzilla.
Suzilla, I like that. Well, you know, I've been like the Suzabot and Suzatron. I'm good with Suzilla.
You're good with Suzilla?
Good with Suzilla.
Okay, yeah, because we've been doing Susie Health Solutions now. What, 5 years?
Well,
we got into healthcare because of the Affordable Care Act.
right, and we just finished season 8?
7.
7.
It was special. It was enrollment 7. We're currently in a special enrollment.
Yeah, and we were RJ Martinez for the first 2 years.
I don't think we made it 1.
We made it 1. Well, you remember you were up in Quincy for the first year.
Okay.
And then down here for the second year.
We made it down here.
And then we rebranded in the third year.
Was the 3rd year?
Yeah.
It was short. It must have been shortly after.
Well, yeah, it was early. But either way, it's been 5-6 years, but we've been doing health insurance for always.
Yeah. Well, you've been doing health insurance always because you came over. You were a pharmacy tech.
It's true, which is not insurance, but I did a lot of insurance stuff.
Understanding of it.
Yeah. Well, that's what makes it such a great fit. Is because one of the things I did as a pharmacy tech that I loved was solving insurance problems. So it was a logical, it was a really decent dovetail into the insurance industry.
Yeah, and it's you do that. You kind of leapfrog. We leapfrog each other for the last 18 years. In jobs.
How'd you figure 18?
I got here in 2002.
Oh, there you go.
And we've been kind of leapfrogging ever since. With one of us taking a primary last June, we became full-time insurance
gurus,
if you will.
I like insurance gurus.
Yeah,
it's a fun title.
We're kind of weird because we don't get paid set salaries.
No, we're totally commission based.
We're totally commission based,
which was incredibly terrifying.
But as an added bonus, we take everyone who comes in the door. We don't charge fees.
No.
So it's a very unique model in that we operate more nonprofit than most nonprofits. But we got to kind of back in profit making.
Yeah, it all works out.
It's weird. People look at us and it twists their minds.
Yeah, it's like, how come I don't have to pay you? It's because the insurance companies pay us.
Correct. And so we're going to talk today about the these are supposed to be nonprofits, but they kind of sort of weird.
Yeah, they're kind of a little weird there.
HealthShares are kind of the Christian alternative. I'll use air quotes.
It's not always Christian. There's a Jewish one out there.
Sort of. There were six that started out with the Affordable Care Act. It was they qualified: Liberty HealthShare, Medishare, Samaritan Ministries, Lutra HealthShare, and the Christian Healthcare Ministries.
Right.
That's it.
That's it. Well, the phrase that's mostly used is faith-based.
Faith-based.
But it's usually a Christian-based.
Cost sharing. There's like they've rebranded this thing about half a dozen different things.
Right. It all kind of has a basic base to it, but it's a different phrase.
Basically, it's non-insurance insurance.
Okay.
And the reason why I say non-insurance is because if you're on a legit site, it'll say this is not insurance.
True.
Whereas insurance money, everyone puts their money in a pot, and the people sit there and draw out that use it. Well, these things kind of work in the matter of everyone puts their money in the pot, and hopefully it comes out appropriately. I say hopefully because there's no guarantees to it.
No. You've got a board of lay people making medical decisions.
It's hard to say. Each one operates separately.
That's true. They all have their own
Little
procedure.
rigmarole. They generally don't take pre-existing conditions.
Yes, that's true.
They can pass judgment on you if it's if you're not married and get pregnant. That's a good example.
Yes.
A lot of them carve out those niches that were the Affordable Care Act set to protect.
Right.
It was something like 80% of the plans when they looked at the healthcare plans on the individual market before the Affordable Care Act, they skipped out mental health and pregnancy.
Yeah.
Those were the two biggies that they always excluded.
Yeah.
That's like kind of the first ones that get carved out really quick out of these health shares.
Well, and you get the whole you get men going, well, I don't need this because I can't get pregnant. And a lot of people don't want to admit that they might need mental health help.
Yeah, it's one of those. It's a stigma. Some of them will have a cap.
Mm-hmm.
So if you get some really crazy coverage out there, and well, our favorite is, hey, you get mauled by a bear.
Yeah.
Or run over by a moose.
Yes.
That's where a standard, a qualified health plan has an out-of-pocket maximum.
Right. The most you'll pay in a calendar year for all of your medical needs.
Yeah.
It's designed to keep you from going bankrupt from your medical bills.
Oh, yeah.
It works. It really does. It made a big difference. It's made a big difference over the last nearly a decade.
Yeah. People estimate that about half of the bankruptcies due to medical debt got relieved because of it.
Yeah.
It's a hard to say number because one of the things that those bills don't take into account is loss of income.
True.
Which is kind of what we're going through now.
Yes, a lot of people.
A lot of people are going through a loss of income. Oh my gosh, I can't work my job. What do I do? So loss of income is one of those huge ones. There's still ways to ensure that. Most people go, I don't have time for that. And well, now you got time for that. So we say, hey, have that conversation.
That was a little weird tangent, but that's a whole other conversation.
It's all about weird tangents today.
Yeah.
Because, well, these health shares are kind of weird in how they work.
Well, one of the reasons why they even still exist, or existed in the first place, is because they were, in the first days of the Affordable Care Act, there was this, if you don't have health insurance, you're going to get a tax penalty.
It goes a little bit before that.
Well, before that, but that's one of the main reasons why it exists.
Before that,
okay, so
and the reason why when I say before that is when they were in that year-long, oh my gosh, what's this Affordable Care Act thing going to do? Before we got to we got to vote on it so you know what you got. That famous phrase. Well, in that there was some manipulation saying, hey, we're going to insert these health-based ministries into the program because of the political influence. It makes them look good. Actually, this year, was it Liberty? I'd have to look. Yeah, Liberty HealthShare and their partner Cost Sharing Solutions dropped $250,000 to sponsor CPAC.
And explain to the people what CPAC is.
CPAC was the Conservative Political Action Committee. Took place this spring. It happens every year. So they basically dropped $250,000 to have a big political rally. So they, there's a certain involvement in politics where that money's coming from, and that's kind of where how they got inserted during that process and why they were created. We've seen throughout the years this weird relationship between the ministry and how they take care of their people health-wise. We've actually had a number of ministers come in, and we look at it and kind of tilt our head because it's weird.
They've got different rules. Tax rules are always a little bit different. It's a little bit more complicated than you think it should be. But you just, Matt and I, we make things like that work. But it is true. The whole church ministry,
retirement, healthcare,
the industry. It's an industry.
Well, it is.
Like
clearly.
not, it's an industry. It's got some really interesting and kind of difficult to navigate rules. There's actually, I want to say unions.
Yeah, it's
Well, there are associations.
Yeah.
Maybe, for pastors and reverends and preachers and stuff like that. They gather up and to do stuff. It's not my, it's out of my wheelhouse, so I don't know much about it, but I do know it exists, and it was a little surprised when I did discover it.
Yeah, and haven't always been that successful.
No, a lot of it I think is because of, with churches being generally considered to be, since day one, churches should always be modest and poor and serving. Well, now we've got mega churches, but that's a whole other conversation. Yeah. And so you're not supposed to be in a lovely little lovely little manner with your, 4 bedrooms and 3 baths. You're supposed to be living a poor life, the life of a mendicant, and it's like, and so you get some really weird rules.
Yeah, and there's some weird perceptions.
And that's part of the perception.
And that's part of the perception. That's why we were offered early on to sponsor one of these plans.
Oh yeah, there was a couple of people who said, "Hey, you should try this out and try selling this because it's like super awesome."
Yeah, because they get a super good commission on it.
That's true. The commission rate for brokers is really steep.
It's actually. I think it's better. I think you get more money selling these things than you do a standard plan these days.
Possibly, depending on the plan.
Yeah,
we haven't looked at the numbers for the health shares lately, but because it was tempting, of course, we did our research into it. Well,
one of the things this actually was brought up last year in Texas. They looked at one of our favorites, Elyria.
Elyria.
Yeah. Elyria, the Texas regulators lawsuit alleged the company leaders reversed that ratio, writing Elyria immediately siphons off over 70% of every dollar collected from its members to administrative costs. Yeah.
So 70% goes to paying the guys who run the thing. 30% is to share to the people who are
the providers, actual care.
Well, yeah, but the money that you pay in, okay, you give them $1, 70 cents of it goes towards the president of the company, basically.
Now this is the Texas regulators.
Right, this is Texas, and then the 30%, the 30 cents goes to, it goes into the pool, and then it goes to the providers with claims.
Now, in the case of a qualified health plan, which is what we deal with,
right. Actual insurance, which is regulated by the Office of the Insurance Commissioner. That's why you vote very carefully on that person. Yes.
Mike Crowther's been pretty good.
He's done well.
80% of the premiums for a health care plan actually go out there and are used on actual health care.
Right. They have to. That's the law.
That's the law. If they miss that, they get rebate checks and they send it out to the actual owners.
Right.
That means if you have an individual plan, you get the check.
Yeah.
If you've got a group plan, your boss gets that check.
Right. Now let's back up a little bit. how these health shares work is you join the share, you join this join this group, right? And you're all a bunch of parishioners, okay? And you put your money into this pot. And if you have a medical need, you apply, you file a claim, you apply, and then your co-parishioners help pay that bill.
That's how it's supposed to work.
That's how it's supposed to work. That's the model. That's not, it's hard to say if that's how it works or not, but that's the official.
We know officially that several companies have been shut down because they haven't operated that manner.
They are not. We've had a couple that got kicked out of Washington State because they were working unethically. But that is the shiny plastic version of it. That's how it's supposed to work. And in theory, it's not a bad thought, but that's not how it practices.
No. And we've been, since we're in this special enrollment period for COVID-19, we've had a number of people coming to us and talking some really questions that were just, oh my gosh, we've been doing this for 7 years and you haven't talked to us.
A couple of us.
Let's see here. One of my favorites was if you have a health, someone told them that if they had a HealthShare account with one of these Christian ministries, that you couldn't have health insurance.
Yeah.
That's a false.
Yeah.
That's just completely false right off the bat. I'm not quite sure who told them that or why, but it was just completely wrong. We're like, no.
Theoretically, you could actually have both because a health share is not health insurance.
Correct. If you want to, participate in that lifestyle of Christian lifestyle, go for it.
Yeah.
Straight up, go for it.
Maybe you can get your copays reimbursed from them.
It's one of those ones. It's worth a question. The next thing was the income.
Yeah.
This is why it's important to talk with someone who's worked with the modified adjusted gross income. The MAGI number. It's what your income is now. Mm-hmm. So if you, oh my gosh, have been laid off, it's what your income's this month.
Mm-hmm.
So we've had people who walked in and lo and behold, they're on our Medicaid system, our Apple Health, because they qualify right now. Later on, if the economy, if they can go out of the house and it picks up, or if they draw unemployment to a certain point,
there's a certain level of unemployment.
A certain level, they will, income out of Apple Health and onto a paid plan. So that happens anytime your income changes 2 months in a row more than $150.
Right.
Either way.
Right.
If it drops or it increases.
Exactly. Now, some folks are going to go back to work after the COVID crisis and get back on their employer insurance. Great. We terminate the Apple Health, they go back on their employer insurance. Yay!
Yay!
It was a safety net designed for just such an occasion. Other people never had health insurance. And it's like, oh my gosh, I better do something because there's a plague out there. So they get up, but they don't have work, don't have enough income. Get on Apple Health. Hey, they go back to work and they say, hey, I really liked having health insurance, and they move into a qualified health plan. Yeah. And we're good at that.
Yeah, we got people who write it up and down. Usually, there are two extremes. Either there's the person with the I've seen it before, 6-digit income, packing the heavy duty latte, the rentals, the I vacation, 6 months in the South America, saying that middle class can't afford it. I've seen that one. And then there's the other that are completely surprised that they can afford health care. I price it all the time, and I tell people you price it. I've seen just ridiculously priced employer plans
that don't necessarily get the job done.
They don't get the job done, particularly for the kids.
Yeah.
They like to hike the kids and the spouse.
Most plans are, I think the plans are required to offer for the children, but the rates are always higher. They don't have to offer for spouses, but what I'm seeing happen is you've got the employee gets usually a decent premium, but to add on a spouse, you're not getting the employer taking up part of that.
Nope.
So you're paying the entire premium for a spouse, and a partial premium. The employer's paying a part of the premium for the employee. Kids are a different mix in there, but they're upcharging you a lot for dependents.
Oh yeah, and if you're young, if you're under 50, price it. Particularly if you look around and everyone's gray hair.
Yeah.
Straight up, if you're in an old industry, insurance, banking, teachers was another one. Yeah. We've seen a lot. I told everyone 7 years ago you're gonna have jobs that you don't want you to offer health insurance because then you get the tax credits. Yeah.
Because if you have an employer-offered plan, tax credits are not available.
Correct. That's a huge thing. So, and then, let's see here, circling back. So yeah, we're going till at least May 8th. It looks like.
Yeah, that's when the special enrollment is scheduled to close. Mm-hmm. And then schools are closed. Let's see, I want to say what's the date for this lockdown?
It's through the year. The kids aren't going back to school.
I'm not talking about the kids, Matt. I'm talking about just general stay at home, stay safe.
Oh, that's May 4th.
Okay, May 4th.
May the 4th be with you.
Oh, that's right. I don't know why that didn't lock in my head.
I have no idea. We might have break out lightsabers and fight later on.
Assuming they're going to let us out.
See, we can fight because we're family.
True.
So the thing with some of these health shares is some of the hospitals are no longer accepting those clients.
Yeah, we're running into that. Because the hospitals don't want to put up with their shenanigans.
They don't want to do here, negotiate for a lower rate. Well, that takes a lot of time and energy. Mm-hmm. What was it? I know in Georgia, they refused to accept a Christian-based medical plan to cover more than 200 patients last year. That was Medishare.
Mm-hmm. The person I was speaking with earlier today with the plan, they were having trouble with that the hospital doesn't want to do this anymore.
No, actually, there's been documented cases with
I'm saying locally.
Oh yeah, locally. The big documented cases was who got kicked to the curb was Liberty over stinking flu shots.
Liberty wasn't paying for flu shots? They were negotiating flu shots?
They were fighting there's actually a site out there of my experience of libertyhealthcare.com.
I wonder if if they as a group are sort of anti-vaccine. That's
hard to say. I will link this on our YouTube page. It's mylibertyexperience.com, and it was just.
It's a little hairy.
It was weird. It's one of those ones like Susie was quick to point out when they were doing should I give this information to you? And it's like, here, you can look us up on the Office of the Insurance Commissioner. Our credentials are here. You can find us on the Washington Health Plan Finder. Mm-hmm. We're one of the enrollment centers. Yep. If you pick one of the enrollment centers, we're one of 11. None of those can charge you fees. Mm-hmm. That's the nice thing about them is, if you pick one of the broker sites, we can talk about supplemental policies. We can talk about we've got a dental policy that we go out with. We got accident plans. If you, like me, I do martial arts and sometimes I'm out of the area. It comes in really handy. We got travel plans. So Medicare is one of the big ones.
Yep, I handle folks who need Medicare, aging in or disabled or want to make changes. Yep, I'm all over that.
We have questions about life insurance.
Yep, do that too.
We do all those nerdy stuff without charging fees.
Yep. Not even good thing about it.
But yeah, I'll throw a couple of these links on there because it makes for a fascinating read on what is kind of out there about these health shares. Some of these health shares have actually sued people. They actually sued a Facebook page for $20,000.
I hadn't heard about that.
Yeah, because they said, Facebook comments on about a Christian health share ministry cost Ohio woman $21,500. Paid damages in 2 companies involved in a Christian health sharing program because of the comments she posted on a now closed Facebook page.
So because of the comments we're making today, couldn't we get sued?
We could, if someone said, "Oh, hey, you slandered us," And we'd go here's the article we pulled them off of. We have every reason to believe that is reasonable and correct. And by the way, here's our liability policy off our professional. We do not commit slander. We'll let you guys fight it out with the insurance company because that's what we pay insurance for. If we did it private, if we were doing this as a private, it would come off our home or renters, our liability policy there.
See, Matt knows about property and casualty stuff too.
I know the geeky stuff about this. As I described it to our web person the other day, I'm really nerdy when it comes to the insurance stuff, and it's hard to find someone with more nerdiness about it. Susie's probably about the most caring person you'll ever find about this stuff.
Oh, you're sweet.
It's true because you took on the Medicare, and I didn't want to tackle that beast.
I love Medicare. It's awesome.
It is, but it's just one of those things that you can get nerdy with because this is how this covers that, this is how this covers this, and people can call in and ask you about questions.
Yes.
I'm like here, I need to insure this log cabin. It's 5 miles from anything. How do I do that? I've had to track down stuff like that.
Yeah.
I get the crazy questions. You get all we've been focusing on the living insurance for the last real heavy the last 2 years.
2 years, yeah. We really kind of pulled our focus. Yeah, and that's cool. Because we're both a lot more satisfied because of it.
It's just one of those things. Yeah, we got people that come to us and say, "Oh, I need a SR22." Okay, this is how you do it.
Yeah. Matt he holds his property and casualty license mostly for friends and family. Well, friends.
Friends. Yeah. This is how I knew I was in the industry. I think the first person that canceled their policy was my mom. Love her to death.
Oh yeah.
She'll still be my mom.
Ask any agent. Writing for your family's a pain in the tushy.
Yep.
Absolutely.
Yep. You will not make it as an industry if you only sell to your friends and family.
Yeah. So
they usually come friends afterwards because they're like, oh yeah, because they realize, oh yeah, if you hold an insurance license, you can never be a felon.
So, I said for that.
Yeah.
So yeah, I mean, we've got Matt's got the property casualty. I do life and health. He's got life and health too, but I never even studied property casualty. I got interested in it. Maybe one day, but
we sit there and we talk actuary fields every so often.
Yeah, just because that's fun.
Like 12 cows a year will kill you.
Weird. So we are really
weird
odd
stuff. But yeah, we have fun that way, and
because we have fun, we're good at this.
Yeah. But yeah, it allows us to have an office. We carved out a space for our son,
which is good because with school being closed, he's got somewhere to work.
He's got somewhere to work. It gives him resources.
Printers, laptops, things like that.
Yeah, it's nice. So yeah, we're gonna shut this Podbean down live.
Yeah.
We'll send out the information because it's kind of fun and exciting.
Maybe edited it up a little bit.
We will see what it entails.
See how it plays. Maybe it's gonna be awesome. Maybe we'll just delete the whole thing and start over.
We will see. All right.
Yeah. Thanks.
Thank you. All right. That's a line. And let's go.